right, a couple more things, probably mean more to folks who are in insurance, but there has to be an adequate provider network. That means there have to be enough doctors, physicians, hospitals, nurses, outpatient clinics to be able to provide the care. And these are actual requirements for the insurance plans that want to sell on the exchange. They have to meet transparency standards. They're actually included in the Affordable Care Act. There are a lot more transparency standards that are built in. Some things are extra. Physicians now have to disclose when they have a financial tie to a pharmaceutical company, an insurance company, or a for-profit hospital. Those things have to be publicly available so that we know if they're getting paid out by a pharmaceutical company, that's a conflict of interest. There are also, so these transparency standards also apply within the exchange. Disclosure of information about, so this one's interesting. Insurers will now have to say how many claims they denied last year, what percentage they paid out, and their cost sharing totals. I will tell you, I was sharing, I didn't even catch your name. Frank and I were talking in the break. We as an organization work with a gentleman, his name is Wendell Potter. He was former vice president of communications for Cigna. And he actually left the insurance industry and became a whistleblower. He testified before Congress about practices that large insurers use to deny carrier coverage and increase overhead and profit. And one of the interesting things he's doing right, he's actually speaking at our annual meeting, and in preparation for that, he just did a series of blog posts about Blue Cross Blue Shield of Tennessee. And he contacted them and he asked all the questions he needed to through the insurance commissioner and through them directly. He said, tell me how many claims you denied last year. Tell me what percentage you paid out for the actual, for benefit claims. Tell me all of these things. And because he knew exactly what to ask and he went to the authorities to do it, he got that information. You and I don't know how to do that. I mean, he used to be on the back end of that, so he knew exactly what to ask. But right now, Blue Cross Blue Shield of Tennessee has an actuarial value of only about 76%. By law this year, they have to have 80 or 85%. So I'm sorry, that's the medical loss ratio.
Explain that. What does that mean?
What's that?
What does that mean, 76%?
The medical loss ratio is the proportion of how much you pay out. So basically, for every dollar that policyholders are paying in premiums in their individual or in their small group market, they're paying out 76 cents to medical care, and the rest is going to profit and overhead and marketing and all these other administrative costs. Anyway, that's just sort of a funny aside. He knows those questions to ask to get that information. We, as policyholders or shoppers, don't usually get that information. But now under the exchange, we'll have access to it in an easily searchable way.
So that's where Travelocity thing will happen.
Yeah. So plans actually have to submit that information to the exchange and it's posted and searchable. So you can say, you know, these plans look great, this one is the cheapest, but I see they denied, you know, this proportion of claims last year, they had this many complaints lodged against them to the insurance commissioner. It's a way that consumers have more information at their fingertips about the way that the insurer actually carries out their coverage. All right, so what's going on? In the planning process, so the state of Tennessee got $1 million planning grant for the exchange. Basically what they're doing right now with that money is they are looking at, they've hired an actuarial research firm to actually look at, all this gets really boring. So they're basically looking at the insurance market and crunching the numbers to try to figure out what options Tennessee could do, how financially this market would work. It's very complicated, as you might imagine. It's way over my head in a lot of ways. But what they're doing right now is basically trying to decide whether the state wants to run our own exchange or not. The state of Tennessee has not decided. Remember, they get the option of, we get the option of deciding whether we want to set up our own exchange, and if we don't, then the federal government will come in and set it up. As you might imagine, people in Tennessee, most entities want to run our own exchange. That means we have more control, that means we have more say. So what they're doing right now with the planning grant is looking at the options. They haven't, the administration has not decided one way or the other as of yet. But when they submitted their grant, they said they had to meet a couple of things. They said in their planning process, for the state to get $1 million, they had to commit to getting stakeholder input. What that means is that they can't just get the input from the major insurers that are selling in here. They need to get input from hospitals, from doctors, from patient advocates like ours, from consumer groups, disability groups. They have to bring in the input of all of these different entities into the process, and the law does say that. All right, on the side. So, federal law was passed, but health reform or the healthcare system in 2014 is going to look different in every single state in the United States because these decisions are now up to the state to figure out how to implement.
Can you go from one state to another state? I'm sorry. Can you go from one state to another state from what you just said?
Say that again?
From what you just said, it sounds like you can't go from one state to another state. If I'm living in Kentucky border, I get my health care in Kentucky.
So, well, there are a couple of different things. What I was saying was basically the decisions that states make right now is going to determine that their exchanges and their healthcare access is going to look very different in one state to another. There is, in the exchanges, keep in mind, so there are going to be 50 different exchanges, basically, that operate under different rules and have different, they have basic guidelines.
Assuming they all do their own state.
Assuming they all do their own. You know, if there are 10 states that opt out, there will be, you know, in those 10 states, there will be a federal exchange that will be combined, actually. But so Tennessee's exchange is probably going to look different than Mississippi's, depending on the decisions that we make over the next year and a half. But one of the questions you had was about going from one state to another. One of the requirements of the Affordable Care Act is that there has to be at least one multi-state plan offered in every single state. So what that means is that you would be able to shop for a plan here that would also be carried in Kentucky or Mississippi or wherever. So there are two models right now. The exchange has been tried in two different states. One is Massachusetts. You all may know that Massachusetts underwent comprehensive health reform. I think it was 5 years ago.
We go 5 or 6.
Yeah. And then the other model is Utah. And they're very, very different ends of the spectrum. Massachusetts has, it's called the Commonwealth Connector. And basically, the Massachusetts model is what the Affordable Care Act is modeled after. This was the health reform that was passed and signed by Governor Romney in Massachusetts. And that's why the medals are used to describe that, because if you all remember, he helped plan the Salt Lake City Games. So he decided that he wanted to name those tiers after bronze, silver, gold, platinum medals. But the Massachusetts model it's what's called an aggressive negotiator. Basically what it does is the state of Massachusetts goes to these different insurance plans and says, give me your best bid. That's not low enough. Give me another bid. Okay, I'll take that one. They go out and they actively purchase. That's an active purchase on Utah. Utah's very different. Utah opened up their exchange and they said, if you want to sell insurance, come on, come on. Massachusetts has a heavy regulatory structure, which means that if the plans don't meet certain standards, they get kicked out. Utah doesn't have any of those regulatory functions. Utah says, if you want to sell, it's like Craigslist is the model in Utah, and that's how they describe their own insurance exchange. That's just some of the effect. I'm going to buzz through this because I'm not sure how we are on time. If you have questions, stop me, please. Okay. All right, Utah model, very little regulation. Utah's model is only offered to small businesses, whereas in Massachusetts, it's to small businesses and individuals.